Joined this evening by Dr. Joan Duggan, University of Toledo Medical Center. Let's talk a little bit about Haiti. It's been all in the headlines this week. If you're someone from this area and you're thinking about making a trip down there sometime in the near future to help out with some of the recovery efforts, relief efforts, medically, what are some of the things people need to watch out for?
Well, the CDC has an excellent website that gives people advice about what to do if they're planning to go down to Haiti for the relief effort. And most people will not be traveling down immediately, but will be traveling down within the next few weeks. Now, some of the diseases that are endemic, that occur very frequently in Haiti, are malaria and dengue fever. So malaria, you need to take medicines to protect yourself against, and dengue is a mosquito-borne disease, so you need to bring repellent for that.
Okay, and you take the malaria medicine ahead of time?
Take the malaria medicine ahead of time.
Okay,
yes.
how
and you need
far
to get
in
a
advance?
prescription from your doctor for that.
Okay.
You usually start, depending on what they give you, want to get at least the medication at least a week or two before you go.
Okay.
You have to take it while you're down there, and then you have to take it for a couple of weeks after you get back.
Okay, so that's a continuous kind of thing.
Yes,
okay,
the malaria protection.
So the malaria and the dengue, what exactly is that?
Dengue fever, yeah, it's a mosquito-borne hemorrhagic fever. And you prevent that, we don't have any treatment for it, you prevent that by using insect repellent. And you have to use a high-grade DEET.
Okay.
Now, other diseases that you'll get there will depend on what you're going to be exposed to. If you're going to be working in a camp for people who are displaced, depending on the sanitation conditions, there could be a number of diseases filtering through the area. Tuberculosis has a very, very high rate down in Haiti. And if you don't have clean water or you don't have a way to dispose of sewage in displacement camps, hepatitis A can be a problem. Other diarrheal diseases can be a problem. And also in areas where there are low vaccination rates, diseases that we don't see here very often can become epidemics, such as measles, mumps, and rubella.
And I guess any kind of epidemic coming from this disaster has got to be a worry right now, because with the bare minimum essentials that people have, they might not be thinking about vaccinations. Is there a lot of concern in the medical community that we could see some endemics?
There's always a risk for epidemics occurring in this type of situation. But right now, for vaccine-preventable illnesses, the main one physicians are concerned about is tetanus.
Okay.
Tetanus, which occurs after tetanus-borne injuries, which are deep injuries that break through the skin and are soil contaminated, which we expect many people to have those after an earthquake with debris flying all over the place. So physicians are trying to get tetanus down there first. That's one of the main priorities.
And as that relief efforts start to pick up and continue, tetanus will probably be, you think that'll be the first priority?
Tetanus vaccination will be a large priority for people right now in those areas.
We'll keep an eye on that. Dr. Joan Duggan, thank you very much for your time. And that is this evening's Talk Back.